This conference will now be recorded.
Then share the entire screen. And that should be.
Oh, don't worry about the other ones.
Can you fix it for me? I gotta print off one of these, dude.
So where do you train at? University of Redwood?
No, so I live here, so we have a loyalty down here. We don't have a U of G or a JRAM like they do in hotel.
So, loyalty. That's not the BJJ guy who has a gym in Elko, Winnemucca, and here.
Yes, that is, yeah. You know him?
Yeah, fuck him.
How do you know him?
I know him because everybody used to train at his gym
No shit.
until all my coaches and shit used to train at his gym until he went fucking AWOL and it's all about the money. He's a. What was that? Chapter
What?
30, right? Scratch and sniff?
He's like, you're talking about my role.
No,
That's-
I've trained at his gym too. It's the most professional gym I've trained at. I've trained all over the US.
Those guys, some of those guys ain't bad, dude. Like, I don't interact with him too
Right,
much.
but
Some of those
as long
guys
as
ain't
you're not, but I mean, he promoted the two youngest blue belts.
bad.
in the
nation.
world.
I know. Yeah,
That's just an insult to the sport.
yeah. We just don't have any other options down here. Like, we just, like, there's no other gyms here,
No, not Battle Mountain.
right? So we'd have to, I mean,
What?
we'd have to drive an hour every single day.
It doesn't-
Oh my
Jones
God, who would ever
do
do
one?
that?
Yeah,
Jones
I
do
mean,
one?
that's tough, right? 'Cause, like,
Jones?
especially when you got kids and shit.
Is that the?
To leave
Deputy?
for
Deputy?
an hour.
I
And then go
think
train
they
for
used
two,
to,
and then drive an
but
hour
they haven't done it
back.
on a regular basis in a long time.
Didn't you have a little area right
University of
down the street from the health club?
That's the Tom
Right
DeGlass
across the
affiliate
street.
gym.
That I don't know.
Redwood. It's good.
Was that the?
Yeah, no.
They were doing
yeah,
ballet
no,
for a while,
sure.
I think, but
Look, Tom DeGlass.
they may have
Even
clearly
I've heard
changed
DJ Ram is
ownership.
really good.
That was, you
Yeah,
remember the old
I just
gym
don't
was?
like
down
some,
the
they
street?
will let anybody
Yeah.
in.
The
There-
past there,
Like,
those
couple
other side of the street was like a
veterans, so,
beauty
like,
parlor.
those guys went all,
Yeah,
like,
that one is,
big
I
rapey
thought
on
I
me.
seen
I don't know nothing about it.
Jones.
Yeah.
don't know.
ballet and the other one's
Come to
down in
find out.
Denver. Towards
He was like,
Pittsburgh.
"Which veterans legal?"
Is it the
Like,
next to the
legal
big
is
rock
not.
building?
Well, that's fucking lame to do anyway.
It's lame to
Yeah,
do.
It's like
Where,
being a
uh,
fucking blue belt.
It's where High had his office for a while.
Yeah.
Smothering? Like,
Yeah,
the only
for a while they were
people
doing
guys.
ballet, and then I haven't seen
He's
since.
running the show, open mat.
Yeah, I don't,
I know
No,
Jones
it was,
saying
that
something
was
about
the
doing something
scare, like
that.
most scared I've ever felt in gym. Gyms are safe places for me.
Yeah. No, no, there's some.
is this your PowerPoint? Are you going through?
No, dude, that's not the one. I need to do the Google Docs one.
So close this down then.
Yeah, we're doing off of Hannah's because that one wasn't fun. That
Number 30. It says we have to sign in. I think you just need your password. Is your normal?
My new obsession.
And I looked for the University of Grappling's schedule, but they don't have like a schedule on.
You gotta go in, yeah,
Yeah,
but I have it.
yeah.
I haven't been in a couple months because I've been potty training my dog,
Still complaining.
but
Yeah.
I was hoping to fight
Oh,
in spring, but now it's probably gonna be December. They are good.
Even like the actual
No, I've been
flavor of
training
the
for like 10
pistachio
years.
itself
No shit.
Yeah,
goes with the taco.
I love it. It's super great,
That's
but like I just got back from Thailand. Like, that
Oh no shit.
was in November actually, so it's been a minute, but.
Okay, so this is where you start it, right up here.
Yeah, and then I click the share or whatever, right?
No, when I set the meeting up, it shares everything on this screen. So if you see it here, it's gonna be sent to the
Okay.
Okay.
We should do the music testing more often because I feel like once the music got turned off, I just.
You went to shit.
Get a set of headphones, man. Play your own.
I can't because Chad said it out kind of cheap.
Yeah, it does. We've had a fucking problem with it last time, and I
Yeah.
really.
He said absolutely no electronic player testing.
Absolutely not, dude. Yeah. Yeah.
Unless we need our calculator.
It's a fucking pet peeve of mine. I thought I was gonna get in a fist fight with the last guy.
Really?
We were having it out in here, yeah. Yeah, it was fucking up.
NH.
I put in
Yeah.
earplugs last
Yeah.
time when you guys were playing that.
He did not like getting called out. I don't give a fuck how big you are, bro. If you're being fucking disingenuous and you're being dishonest, I don't give a fuck, dude.
But what's the point of
Bastard.
cheating? Like,
You're cheating yourself, but it makes your staying in the class look better. And I think that was what was important.
Well, didn't
Was
you
he
say
from
last
Marigold?
year was
No.
so competitive?
He was the dude from the town.
Was that what you said?
I thought I was asking if he was from Marigold.
He used to.
Yep. Yeah.
Oh, gosh, okay. Yeah, because I
Yeah. I'm sure to go to assemblies and shit like that.
I wonder what.
My insurance is just fucking me around.
Hey, we have the greatest medical insurance in the world.
Who's working tomorrow?
See,
Oh, I left.
why, do you ride along with him?
Yeah.
I think it's him. And Marcus.
DJ, Mike, Billy Ray, Ron.
Wonder who's working Saturday.
What do you do?
Oh. Waiting for it.
Better tell her to fuck up.
I know, right?
Leave.
But you just bumped it.
This is not. I started fucking scrolling. I'm not even done on 29.
I was in the van this morning, driving around.
Oh shit, give me my ELT ready.
Because, it was all.
Please, all middle ELT numbers, please.
So I grabbed it, and right after the answer,
They're all allergy, geology, and I was like, fuck yeah, there's my friend. And I was all, Harlan. But they're like, who's Allie? I was like, oh,
You
she's
working
working
tomorrow?
on geology.
No, I'm taking Friday, Saturday, Sunday off.
Who's working Saturday?
I can't find the schedule,
Black
but I
Cooper
have
Monster.
it. It's just in the depths of my photos from last year.
Yeah, no sweat, man. If you can find it, dude, yeah, send it over to me.
Who?
Marcus Jury and Michael Hooper.
I know it, so let me just.
Right.
No, Saturday.
Who's working tomorrow?
CJ and Ron.
They right along?
Yeah.
Oh, yes.
So, I just have to memorize. So Monday and Wednesday from 5:30 to 6:30 is wrestling. Tuesday, Thursday is jigs.
Is it he or joking?
Bring both.
So they do both. I mean, obviously they do
Yeah,
both, but they do both on the same day.
No, but
Oh, okay.
it's like, sometimes it just depends on what we're like doing, where we're at in the lesson plan.
Sure.
But, a lot of it is mostly like no-gi, which is applicable to gi. And then every once in a while, it's like specific to no-gi. Or to
I try not to do it, like,
you don't like gi?
it's not that I don't like meat.
It's like eating your vegetables.
Yeah, it's that I don't like, I try not to be a key player, if that makes sense.
Oh, I'm a bottom bitch, straight up.
Yeah, I'm
I'm
like, not,
spider guard, like
yeah.
lasso, love that shit. But it's got me out of some bad situations. But yeah,
So they have adult twice a week.
so I tend to show up at like 5:30 and then I just stay there until class is over. Tuesdays, Thursdays after jujitsu is stand up, so it's American style boxing at I think 7:30, and then it's Thursdays are kickboxing, Muay Thai, but more like a Dutch. And then it depends on who's coaching. If it's Spencer, it's more Dutch. and like MMA focused, but if it's, he was new, but he's like a 15-year Muay Thai coach. He's got like the form and stuff. He didn't compete Muay Thai, but he knows the fundamentals, which is really great. And that's on Thursdays. And then Wednesday nights, after, because it's wrestling and then jiu-jitsu. And so it's like each class is an hour. So Wednesday, 5:30, wrestling, and then jiu-jitsu, 6:30, 7:30. And then it's 30 minutes open mat after that. Fridays, every other Friday is open mat, but then they switch between what's his face's gym, they play the
down
Day
almost
Breakers, and then University of Traveling.
$7,000.
And
Why?
but
Probably
Wednesday,
because it has
late night,
241,000
those are my
miles on it.
birthdays because I'm there from like 5:30 to 10, because after that it's like 2.5 hours. First week was, no, it was last. No, I don't.
I mean, it's pretty nice though.
But he was on the Mexican Olympic team, I think, or boxing. He's really good. Yeah.
So whoever had it took pretty good care of it. I mean, except for mine.
Oh, yeah.
Obviously, there was a big split over there where they were like, hey, massive
Looks like gooseneck.
between Jay Ram.
Is it hidden gooseneck?
Yeah.
So Walmart
flip over.
Gym, your
And the
guy,
inside looks nice too.
he
Probably
was,
older dude.
he's in it for money. So that's why he promotes super young
But it's
kids.
the
That's
knowledge.
why his, like, I went there and
So to
trained
see a
like 3
13
years
at this
ago,
price
like,
kind of makes me wonder, but at the same time, I'm like,
you know, when
it
you're
could just
young,
be
and I
injection.
tried to give.
Yeah,
I
it was never in a
was
wreck.
appalled. Fact that, like, every gym I've been to, like, you see somebody with some experience, they sign the waiver.
They have another one in there too, that the guy just sent me a
Like,
picture of,
they
but it
have
looks like it
certain
was
rules,
real hard
like,
to
hey,
do it.
you're only allowed to roll with belts, whatever.
You're kind of beast.
They.
Yeah, exactly.
Okay, well, there's a combative class after this, and they're like, yeah, no, it just said. It was weird. I went and talked to what's his face. There's more tea behind it, because my coaches were directly involved, and they are directly, they're the ones who like initiate the big scale after him.
I just like that
I
big
just
screen.
forget.
Because they were all, it was all one gym.
Yeah. Yeah, and then he kind of fucked over lunch. And
No,
so
just
get
he
a
fucked over
monitor.
Brandy,
Okay, yeah, I get it.
Spencer,
I get it.
I'd have to
Yeah,
see
because he
him.
won't talk about it. Because
I'll pay you.
he fucked
And
him
like,
over.
We don't see him, like, we don't see him.
Yeah, because he's running a franchise. He's
Not
not
that
running.
twisted.
Yeah, no, no doubt.
It's just,
No,
Why?
I
I might like you.
but that's just it.
Oh,
It's-
fuck, dude.
He's such a disgrace to like the heart.
We
and
talked
soul
about
of
dragging
the
him shit the other day.
Like I said,
And, like, I
I've been
stopped.
to
I was like, what?
I've trained people on American television, and,
Hey.
you know, the Hero Brothers and all this, like,
His voice on the
I
radio.
never.
He tries to make it sound.
Like,
Which one is that?
as I was at this,
Oh.
even like, there's a gym in Mother that's super traditional, mostly like. And
Hey.
it's like, you know, like,
go to Jay Ram gym too.
There ain't nothing
it's-
about
I
it. There
didn't
ain't
go
no
to that one,
hiding.
I went to,
There ain't nothing.
You think he's full-fledged gay?
Oh, he is.
I don't remember, it had a sticker
I've been told
on it,
stories.
my backpack, but
Oh, he is.
I
Yeah.
find it.
Oh, and he
But yeah, there is a
twisted
gym
loves
over
Aiden.
there.
Oh, really?
This was like a.
He wants to touch his TV with his.
Yeah. I like this shit.
Just like we give shit about Peyton and Aiden.
Uh-huh.
That
We're like,
gym,
you guys
but,
touch people.
especially like after what.
Then
I
the other
heard
day,
doing the
one of the guys goes,
like,
Peyton, are you gay? He goes, I don't know, I've never tried it.
But absolutely.
I was like,
Yeah, my 10-year-old.
All right, baby face Hayes, let's
How
get
many
this,
times did he actually
let's get this straight, right?
Trinity,
So happy.
Trinity, I used to work with.
And
I was on the same crew. His
Um,
girlfriend was at the coffee shop. One day, him and his boyfriend came in.
I heard it was
They're
a lot more
fucking
than that
selfish,
from my other friends.
Yeah, there was a little bit where they had.
And then
like,
they were asking for like gas money stipend and,
I don't know, nothing for me.
yeah. I was trying to find out, dude, but I'm telling you, it's worth the drive to Carlin. I don't think there's any.
Cool,
I
dude,
know
just-
a lot of people who come and train at University of Grappling
Right.
in Carlin.
I don't give a fuck,
It's a
man.
lot though, dude.
You do you.
know. They went to school free, and run around there.
If you care about the sport, it's,
Yeah.
and kids class is at 4, I think. You, no, show them play. Yeah. Like, I mean,
How much is it, what are they charging their guys?
it depends, they work on different family plans, but like I was paying for like unlimited access all the time. And I was at like, I think it was like a month.
Oh, shit.
Some of their games aren't bad, dude, like,
Shoes.
you're not wrong.
Holy fuck.
Hey, did we get a new haul truck?
I would say.
Mine?
No.
No.
I think
parts.
Jack's probably-
Okay, 'cause here's like heads up, wide load headed west of Valmy. Load will go to Golconda
A little
turnaround,
bit, I used to train a little bit.
head back east and get off of Valmy. Yeah, that had to be the bed.
We got 2 beds.
2 beds?
Yeah.
Also, they're
Got one
shipping
across
two,
the-
two of the trucks, they're shipping parts for 2 of the trucks in that one.
Friends,
Oh yeah, I'm getting 504, baby.
was actually.
Or whatever numbers they have.
Okay.
Is it, are they doing
503?
Yeah, they came in at.
504,
1:00.
505?
Yeah.
He's
the two
he's
diesel?
like a
Well,
legitimate.
It depends because they're probably not gonna be new
But
trucks,
then
they're gonna
you
be
go and
gas
say
force.
shit like Tent Planet.
Dude, like.
Yeah, but
Tent Planet has
unless they
a
put one
they have a
that's
style.
488,
They also have
so there's no 88, but that was that old
Yeah.
Hitachi.
Ask him.
One of
Yeah.
them,
How many times
one of
you got
them, they're not
remarked
gonna
Tent
renumber
Planet?
because that was the.
Do that when you like take us back next time. And like
Fucking
the
chip
third
dependent, I would say, you know.
No.
Yeah, that's
it's Tent
480,
Tent Planet, there was
80 or
like-
81.
And then the
Planet.
twin
Yeah,
sister
it's
to
their
that
training
one
practice.
started getting
They
possessed
ass.
after that. No, they're having
Washington,
problems.
Oregon, California, all those Tent Planet things. City.
I mean, they got.
I should have
Yeah, no,
sent,
they play, they play.
I should have sent you some money to stop by the store.
And you can- Like,
I
I'm
told
not saying they're
her.
bad.
Yeah,
I'm
well, I
saying they
think,
gotta
I think
change.
that's right, right, like, you talk about like Boogie and Gio, they're like very, like, full
How
guard,
about that?
play the legs.
Yeah.
But
No, I have to go do that
the
here
other side, guys
probably
like
in
Steve Burrell,
like
who are
10 minutes.
Wrestling heavy.
Yeah.
Runners and Mills, I get my medication.
Like, they set up a good.
Are
competitive
lovely.
competition, like, driven.
At least they
And
know
it's like,
better than
I don't know.
And then
That's
my
not-
doctor-
It's the same
I've
thing
been-
as I ever, not
but-
much difference.
There's boobs on that one.
There's
So?
not many girls that do it. So like when I go to a comp, I'm
That one-
like,
those
medaling
ones
every
that do-
time, and I'm like,
I've done.
I didn't even.
Yeah. On your knees. Do it this way.
Right, I don't-
I used to do that one. Look up Joe
Best
Rogan's.
was when, no test today.
That's what we
Here,
started to do.
no test today.
Joe Rogan. Kettlebells.
It'd be cool, it'd be cool if we had a position down here.
Yeah. But it's about, there's barely a grocery store.
I think we have like. Between the kids and the adults, probably close to like 35 people, like.
That's a good sized class.
It's not- Nah, yeah, not per class, right? Our adult class normally has like 7.
Oh,
Cardio.
Yeah, it's not crazy.
Build strength.
What is it, how many people are in adult class?
it's a lot. I roll three different every, like, even, there's a lot of women, actually.
Have you been doing
It
the
depends on the
mask?
class, like, there's like 15 for wrestling,
Just keep
there's like,
keep doing it with the mask so you.
Depends on
you
who's
just- so you're gonna
fighting.
go blindfolded.
it's got like fights coming up.
Ooh,
There's anywhere
you're
between
gonna be
like
amazing.
10 to 20, right? Okay, there's, I mean, don't get me wrong, if it rains, it's like people are made of paper, and there's like 5 or 7 of those.
Where they're just gonna put your mask.
So you say your average would be like 15?
You're just gonna crawl
10 to 15.
if they have it this year. But all it is you go in.
Well, like, I've been doing it
This
for
way.
10 plus years now, I'm still a white belt.
through.
Like, I don't roll like a white belt, but I
It's
travel.
not, yeah, well, I think that's a, you see people that are voted to like go out within a year, unless they're like
Telephone cables.
Yeah.
legitimate, like their
They're not
full-time
gonna
job
work.
is this, and they are like.
No, I trained with a guy who won worlds in Brazil,
They're gonna make it to where you can get stuff,
at blue belt,
but you're gonna
purple,
have your axe.
and brown. and he just
So,
didn't have
I
enough
said-
time for his black belt.
Yeah, so like, say this is you.
I was there when he got promoted, like he's,
I have to
forget
go
his
my
name,
side.
but he's missing like most of his
Then what
fingers
I'll
on
do,
one
what I
hand.
did last year is I ran
And
it
he
this way.
still, he would get
And I
grips
ran
over
it up and
business.
over.
I don't even know how.
I
That
slid
man was missing
underneath.
fingers and he would still,
But then that's
Kill
it,
it.
and then you gotta make a,
but
this way, this way, this way.
yeah, he won worlds, I think 3 times. A brown belt before
Go.
he got black belt.
Thing.
No.
Let's do that.
Bald, white guy, looks like the kid off of, like the Cabbage Patch Kids. I can't remember his name.
There's that stuff.
He's at a newborn cast out. Yeah.
Trying to.
Tubular thing.
I'd like to get back into martial arts.
Oh my.
That's how you lose weight.
Well, there's a lot of things. Well, not a lot of things. There are a couple things that need to happen before I can get back into the
Yeah, we go. Tell your guy to start gym down here. Does Tom the last ever go over there?
Yeah, he was there, right before I left. Yeah.
Tom the last.
Oh, no.
I'll let
Shit
you
on
know.
BJJ fanatic.
No, you're not.
Yeah, I'm gonna start training again because one of my kiddos, one of my friend's kids wants to start getting into it. And she's a little badass in production. I need to get back in and go to more potty training, but I bought a house. And I'm done. Started this. Oh.
Yeah. Fuck yeah.
Jai Jai, you're too far away, I saved you a seat.
Sorry, this is my spot now.
Oh, come to the dark side.
Damn.
I don't like the dark side, and I don't want to play a host with you all day. I'm a lefty, I like the left corner.
Well, then you can take this spot, and then
Yeah, you like that?
Jakey
We're
Poo,
picking up bubble dicks.
that's fine, Jakey Poo can sit with me. We like the dark side,
Jakey Poo loves you.
and I love Jakey Poo.
I love Lakin when she's here.
Wow, do you give her snacks?
I didn't even bring snacks. That's the one reason you want me to stay with you. You just-
No, I brought you snacks.
You're a pet.
No, I'm a bitch. Different, very different.
I wasn't gonna say that part.
No, I have steak.
You have steak?
Steak. I already ate all the Chinese food unless you want my peppers.
I'm not.
And I had donuts, but they're back at my office. I forgot.
I don't want anything.
Are you okay? Are you feeling well? How's your lymph nodes?
Extra large.
Get away, sicko.
Just the one.
Just the one? You're fine. Come sit with me.
I don't know.
Jakey- Jakey
Sit
Poo,
here.
Jakey Poo saved you a seat too. Now Jakey
You can
Poo,
sit right here.
no, Jakey Poo doesn't,
And you can sit.
Jakey Poo doesn't want to sit in the light.
You can marry her. There you go.
Wow, the order's been disrupted.
The order was disrupted when they changed the tables.
Yeah, but today, there's bad in the air.
What?
No. You just did good.
My pigment starts to shut
What?
down. Show up late, you don't do nothing all day? I was like, yep, that's how it rolls.
Right.
So I was in and out of the dispatch office all day getting
Are we fighting?
Is that what's happening here? Like, come on now. I sat in this chair like 2 weeks ago or something, no one was here. Bullshit.
Who was there on Tuesday?
That dude's not coming.
You guys ever drink this?
What is it?
Is that the Alani?
Alani?
Which flavor?
I don't know, but it tastes like Bigfoot's dick.
Yeah.
Tastes like this.
You guys gotta try that mango fuego C4. That one's good.
I can't do support. It is too much for me. I turn into a crackhead.
I'll stick with my clock.
The WWE one is that one.
Okay, I can drink it when I don't have to go to the
Yeah,
gym.
there's one
If I have to go to the gym at some I'm that day.
I didn't lose the work.
It doesn't add.
So I can't-
It was a newer
No.
the whole time.
You always make business with them.
Dude, that's
Oh.
perfect.
Just straight to the dome, dude.
Oh, yeah, that's right, he's gonna be gone, huh? Okay, Frank's gonna be gone, Lakin's gonna be gone. Okay. Sign the sheet's going around.
And then I'll be gone next week.
What'd you say?
Then we're not testing. right?
No, you're not testing. No test today.
Hey, so one more time, are we testing today?
Hey, wait, we're testing, right?
Lakin, Tina, can you guys?
Yes, I can hear you.
I'm not muted, bro, right? Like this is fucking, this thing's going crazy, dude. Tina, you can hear me? Am I muted?
What?
I can hear you. I'm sorry. I typed it in the chat. Usually they have the microphone turned off on their end.
It's the red mic.
Tina's trying to talk to you.
Can he eat me?
Wait, they're typing in the chat.
Okay. Very good.
Where's Frank?
What did you say? He said, where's Frank? Is everything okay with family?
What a funeral.
She says it all nonchalantly.
You tell these guys what you want in your office today?
The microphone is on and these are being recorded, so. No, I didn't. I did not.
Tell us what?
You had to do that. That's the feng shui or your room.
Do we need to go look? So we doesn't have to say it?
It's gone now.
Oh.
Now you're gonna have
Is it what was getting to the wall last time?
Fix that. It may or may not have had to do with what was maybe or maybe not into it.
I can make an educated guess.
Sorry. That's the vibe. Shia, I'm in shock.
I don't know why I can't hear them, but
Sitting over here in the dark.
whatever.
We still have a good clotting factor with all this.
Taking half the nursing home, have you?
No, but I should.
We have 2 minutes.
That's my fault.
I just got
Nice reflexes.
give him the club.
It's still
Don't
one
give
leg off
up
the
those
table.
ones.
You probably shouldn't give that to anybody. You have that keep it to yourself.
Where's he out of this bad boy?
About every week he's getting brought it up. Because I was like, let's give him the clap. They're like, yeah, clap, don't give it to him. Whoa, whoa, whoa.
Every time
Whoa,
I
that
hear
is
it,
super
I'm
close.
Yeah, it is close, too close.
I might stop at that minute.
Oh, yeah.
Trying to be on my tiny little.
Until they get older, then they have like COPD, where it like feels like they're suffocating.
Hey, you know, she trained me on a haul truck years ago.
Roberta?
The little short Roberta, older lady.
Yeah.
She fucking smoked every single time he stopped. Dude, insane how much she smokes.
There was a lady that I delivered to. She passed now, but she said like if she could go back and tell like all the young kids one thing is don't smoke because that feeling of not having enough air that comes from it isn't worth it.
Yeah, okay.
Like you'd go in and be like, oh, how's your day? She'd be like, well, unfortunately, I'm still here. Like she just wanted to die because she felt like she couldn't breathe.
So her
That's
grandma had
crazy.
a heart attack and a stent. Smoking cigarettes.
That's crazy. All right, guys, we are officially 5 o'clock, so we'll go ahead and get this thing kicked off. We have the sign-in sheet going around. Those of you that are online, Lakin, since you're online, we'll just get you to sign it at some point. And then Tina, it sounds like Kim is going to run you through the skills down in the south. And Lakin, I will get with you at some point and get you like the skills practice that you're going to miss tonight. So don't worry about it. No test tonight. The 29 and 30 are going to be combined next Tuesday. I'm sure you guys are, like I am, ready for Chaz and Becca to be back. I don't need.
I like your teaching practice.
Don't stop it, dude. Don't fluff
I
it.
think you guys should go like off it, like one day of the week they do it, and then one day of the week you do it.
Honestly,
That's
that's
too,
dope.
that's too much damn work, dude.
No, I think you can do it.
What's up?
Please.
I've enjoyed having a house to myself.
Have you? I bet it's been nice, dude. Yeah.
You should do it.
I mean, the truth is, I'm just piggybacking off all their hard work, right? Like they put this stuff together. So,
They're all watching the video later, they come back, they say, so who missed us?
yeah, like
You're failed.
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 Yeah.
Okay.
that's exactly it.
So we'll start with a little bit of recapping. What did we go over a couple days ago?
Well, we went over the trauma for the first time, trauma.
Yep. So what was it? It was
And shock.
bleeding control and shock. Good. Good, right? The trauma diamond of death. We went over different stages and types of shocks. We went over bleeding control. This is a continuation on that. And like I said last class, the difference between good and great is your knowledge in anatomy and physiology. And that will ring true all the way if you decide to become, a paramedic, a doctor or not. It doesn't matter, right? Like the difference between good and great is your knowledge of the human body and how it applies to what you do. Okay. So we're going to go into soft tissue trauma. This is actually one of our old employee slides, but I would say the objectives today are going to be, we need to have a solid understanding of the A&P, the different types of injuries, injury patterns, the difference between closed and open injuries, and then we'll go into some treatment modalities, and we'll start. This will be the introduction to burns, okay? All right, all of this is soft tissue. It does not include teeth, bones, or cartilage. Everything else can be included into this. The majority of your soft tissue is going to be what? Your integumentary system, okay? The skin is the most obvious soft tissue injury, the most obvious organ that's injured in soft tissue injuries. The skin, we're going to do a little bit of a review, right? It's protection, water balance, temperature regulation, excretion, shock, impact, absorption, skin, nerve ending, provide sensory output. So we can see why, like, taking an impact or having an injury to your soft tissues is like a big deal and important, because you start losing your regulatory functions, like then you lose your ability to compensate. Okay, we're going to review the epidermis, dermis, and subcutaneous. We go from outermost to the innermost. And there should be, maybe it wasn't on this slide, but there was a good picture that one of these slides had depicting the different layers and the thickness of them and kind of where your nerve endings run and stuff like that. Okay. Closed wounds is exactly what it sounds like. There is no open pathway. Now tell me, if I have a closed wound, does that mean that it is not going to be life-threatening? Absolutely not, right? What did we learn? You can completely bleed into your body and die without dropping an ounce outside. So just because there is not a entry pathway to a wound does not mean it's not life-threatening, okay? And your types are going to be contusions. What's a contusion? It's a bruise, right? Okay, what is a hematoma?
Is that like a blister?
Okay, so a hematoma, if you actually, like, if you didn't have the definition up there and you just saw the word hematoma, like, what would go through your mind? Yeah, right, like, hema is blood, right? So the first thing you need to know is blood, and it's a collection of blood at the site of the injury. And then a closed crush injury is blunt force can cause internal organs to be crushed or ruptured, causing internal bleeding. Okay, hematoma versus bruise. I think the big thing is that large collection of blood from like a vessel leaking. Everyone in here has had a bruise, right? Like, we don't need to cover bruises that much. Okay. Okay. Closed wound treatments, there's not a lot you can do. There's very specific cases where we can do things, but as far as like the big picture of treating any closed wounds, it's literally managing the ABCs and treating for shock. Okay. We can throw a tourniquet on an arm that's hemorrhaging, but like, what do you do if you're hemorrhaging into your pelvis? Well, I guess you can do a pelvic binder, right? Yeah, you can do a pelvic binder, but like, you know, into your stomach or whatever, right? Like, there's not a lot. You just have to manage your ABCs and then treat for shock. This other stuff comes like the cold packs to isolate injuries and manage pain and splinting. Those things are important, but you can't get to those until you've managed your ABCs. So there's a lot of times on calls where you're not going to get to that. You're not going to get to the ice pack because like your ABCs are not fully managed yet. And your ABCs have to be assessed, managed, continuously reassessed. If you get to that point, great. But if you don't get to the point where you got cold packs everywhere, like, don't sweat it. Splinting, we are going to get, have you guys covered splinting yet? Okay, cool. That's okay. We're going to get into it a little bit, not so much tonight. Very basics of splinting is, right, you're going to mobilize above and below, and you're going to reassess CMS every time, okay? As long as you remember those three things, immobilize above the injury, below the injury, and reassess CMS, you'll stay out of trouble when you're splinting.
CMS stands for?
Circulatory motor sensation. Okay, so pulse, can you feel this? Is it working? Okay. Open wounds, an injury in which the skin is interrupted. Okay, so you have a pathway to the inside at this point. Abrasions, lacerations, and penetrating trauma. We all kind of understand the difference between an abrasion and a laceration, right? Abrasion's like I have a little bit of road rash, okay? Laceration is going to be more like your cut, and then penetrating trauma passes through the skin and other tissue. This is going to be like, you know, your gunshot wounds, your stabbings, things like that. And I mean, you can have a laceration from a stabbing as well, but when I think of penetrating trauma, I think of deeper, right? When I think of a laceration, more superficial. Avulsions, it's going to be a flap of skin or tissue that's torn loose. Amputations, you know, the complete loss of a body part. And open crush injuries, this is going to be like an extreme force situation, right? It's when your extremity is caught between two heavy objects. You guys that work at the mine are probably pretty susceptible to this. I don't know if you guys ever looked around at the equipment you use, but you're the softest thing out there, right?
So you said avulsions are
It's like a flap.
like pretty
Like
much
your
laying something.
degloving
Yep.
Okay.
stuff, right?
Yeah, the degloving absolutely is a type of avulsion. Just think about like anything that's kind of like flapped over and open. That's going to be like an avulsion.
Impalement, would that be considered an open crush injury?
Yeah, I would consider it more a penetrating injury for sure. But I guess that depends too, right? Like, there's nothing that says you can't have both of these at once. But yeah, most of the time, if you're like, that's going to be a penetration most of the time. Okay. Blast injuries, where we're going to see most blast injuries is going to be industrial sites or acts of terrorism. Okay. And with blast injuries, you have, I think it's like at least 3 or 4 different injury patterns that goes with that. And then high pressure injections, you guys are actually probably more susceptible to these than we are because of, you know, the amount of pneumatic and hydraulic tools you have. Yeah. Okay. Little examples of everything, right? Amputation is going to be the loss of a portion of something or the entire extremity. Avulsion, you can see how that hand is kind of filleted open and over. Crush injury, you see how that's deformed. Your laceration is going to be more like a cut. Abrasion is going to be like road rash. Now that being said, like a substantial amount of a substantial amount of tissue that has abrasions to it, like that, it's not normally going to be a life threat. But if you think about what your tissue and what your skin system does, right? If you've lost like 50% of your body's ability to compensate temperature, right now you can go into hypothermia. As we learned last week, hypothermia can decrease your ability to clot, increase your acidosis. So abrasions generally, like, you know, aren't the biggest deal. Like, you know, we've all skinned our knees. But if you have a large portion of it, like, you know, you lay a bike down and you skid for 50 yards, like, yeah, that can be a real problem that you have to address now. Okay. And then punctures. Does anyone have any questions on these? Okay. Okay. Someone tell me what the top left corner, what that is, what you would call that.
What, the D glove or?
The top left. Well, that'd be,
Left. Top right.
I mean, that is
going
still,
off his left or?
yeah, no,
our
this
left?
one up here, right?
Okay.
This one up here. What would we call it?
Laceration.
You'd call it a laceration. Anybody double down on laceration? Okay, what if I told you that I think that's actually an avulsion?
Oh, yeah. I can see it.
No, just tell me I'm dumb. That's a fucking laceration, right? Just say, hey, you're dumb. Yeah, that's a laceration. You're absolutely right. That's a laceration. Okay. What about the one under it? What about that one? That's a laceration too. Okay. What would you call the foot? Could be a crush. If that was flapped over, you could even make a case for avulsion.
Where the big toe is, yeah, wouldn't that be the avulsion part? Or is that a bone stick?
It could be. That's what I'm saying. Like, it could be kind of both.
That thing got sat on by something.
I would call that foot probably like a high pressure crush injury. And then I would call that hand an avulsion, right? If you see the way that that's flipped off. Yeah. Yeah.
Wait, which hand do you think is an avulsion?
This hand right here, I would call that an avulsion. The top right with the green. Like if you see, yeah, but what kind of injury is a degloving, right? That tissue is off, right? Mike, what would you call that hand?
Same like an avulsion slash.
Yeah.
Like you think of a degloving and like it is an full stick.
Yeah.
Right.
And is that injection injury below it?
Yeah. Yeah, I would say so. I would say that's a high pressure injection, and that's penetrating trauma. Okay.
How can you tell that's high pressure versus just a puncture wound?
Because of that halo effect. Yeah, the halo around.
Yeah, right. Like the halo and like the paleness around that, right?
Yeah.
All puffy.
Yeah, you have some circulatory compromise for sure. That halo effect absolutely cues you in. Good job. Who said that?
Please.
Well, you guys all said something similar, and it was a good job. Like that's a good catch. Okay. Okay, so we're gonna go over open wound treatments. Remember, we don't get to this point until we have gone through our ABCs or our March algorithm. So like, okay, expose the wound, clean the wound surface, control bleeding. Again, this is not like, oh, they're massively hemorrhaging and we're cleaning the wound site. Like, okay, so control bleeding, provide care for shock, prevent further contamination, keep patient still, reassure the patient. Dressing, we're going to use, hopefully you have some, what's the word I'm looking for? Like manufactured or for treating open wounds. Hopefully you have like some manufactured dressings, right? Don't get me wrong. Like if you're using oily rags to stop a bleed, like it's fine. You do what you have to do. What's up?
Just looking for some guys.
Yeah, I'm just looking for like some, like a word for some like medical grade.
Sterile-ish.
Yes, yeah. So like dry sterile dressing, some sterile gauze, if you have it. Guess what? If you don't, and you're stopping to bleed with an oily rag in the shop, it is what it is. I can guarantee you this. Anybody with an open wound that goes to any medical center that's half competent is going to get broad spectrum antibiotics. Okay, so don't lose your mind if you don't clean the wound surface, right? If you have the time, they're stable enough to do it, great. If you can't and you don't, frick it, right? It's fine. Like they'll get antibiotics anyway. Okay. Yeah, no.
You can't clean hydraulic injection. That has to be like a plate of.
Yeah. Yeah, 100%. Yeah, that'd be tough. Yeah, so use the appropriate dressing if you have it. Use what you have if you have nothing. But if you can use dry sterile gauze or hemostatic agents and stuff like that, that's what you want to do. We're going to apply direct pressure if it's in a place we can to control the bleeding and prevent further contamination. Remember, stopping the bleeding is always our priority before further contamination. The bandaging, you can get creative with this. We carry ACE bandages. There's Israeli bandages. If you're just, tying a shirt together to create pressure, like honestly, as long as you're creating some kind of pressure to hold it in place, and it's not like the first thing on the wound, you're probably doing okay. Okay. Yeah. I mean, it's not, if that's all you, 100%, dude, 100%. Yeah. If that's all you have, if all you have is duct tape, then use the duct tape, right? I am hoping that wherever you guys end up, if you end up working in EMS or wherever your work setting is, that there's a first aid kit with a pressure dressing, some tourniquets, right? Some basic things so that you don't have to use duct tape. And here's the deal. If you're like an outdoorsy person and you don't have like a pretty built out first aid kit, you should, because it's super cheap insurance. The stuff really doesn't go bad. Occlusive dressing causes an airtight seal when caring for open wounds to the abdomen, chest, and neck. We'll get more into occlusive dressings because they're very versatile. We use them in a lot of different instances. A good rule of thumb when we're caring for open wounds is if it's a wet organ, it should stay a wet organ, right? So if we have a avulsion or an evisceration out of our abdomen, right, and we have like intestine or a organ hanging out, we probably need to keep that organ wet. So we need to make a reasonable attempt to, as sterile as possible, get whatever we're going to use wet, right? So you should have like some sterile water or something like that you can do that with.
Yeah, non-pot materials.
What's non-pot?
Non-potable.
I thought that was like, I thought non-pot was like, no, I thought it was like something you use like if they're about to drug test you, you know what I mean? Like you just like, you squirt a little non-pot in here. Oh, is it? Yeah.
Just straight nasty.
Yeah.
Sometimes it's tan.
Okay. Open wound treatment specifics: abrasions and lacerations, dress and bandage the wound, control bleeding with direct pressure, flip those around. Control bleeding with direct pressure, then dress and bandage the wound, okay? Penetrating trauma, reassure the patient, search for the entrance and possible exit wounds, control the bleeding, treat for shock. And I will say if they have an impaled object that is penetrating trauma, we do not take it out unless it's occluding our airway, okay? That is a gospel. That's like part of the 10 EMS commandments, okay? You do not remove an object unless it is occluding the airway.
So on the, like you said, controlling bleeding or holding direct pressure and then controlling bleeding. Like we were talking, I think it was a couple of days ago that we were talking about not removing anything, so we're worried about the clotting part of things.
Mm-hmm.
But if they're still bleeding, like actively bleeding through that, are we okay to do that, or? Because I know that was kind of the argument. We never came to a final say on that.
Are you talking about an actual impaled object or gauze?
Just a full-fledged open wound, no helmet.
Okay.
Like actively.
I think the book says that you don't.
Yeah, I would go with that for now. Yeah, I would go with you don't. That's a very hard situation, right? Because for one, that means the quick clot has failed, and that was the first thing to go in. Two, it means it's in a place where you can't apply a tourniquet to get to a point where like you're making the decision to either pull it out and restart or not. For now, I would say pack it, and then we don't remove it unless we absolutely. And that being said, right, if somebody's going to die and you're like, this is not stopping it, and you do it, it's kind of sixes, right? Because if you are 99% certain that they're going to die anyway, and you're like, you know what, it's the fourth quarter, we're throwing Hail Marys, and you're doing it within your scope of practice, I don't think anybody's going to judge you for it. He might, because he just likes to judge everybody. Because kind of.
He is not.
That's right. Just don't.
He is not impressed at all.
As long as you're not doing this.
You want to go there. You want to start. Gosh. Golly, these guys are bullies. Okay, open wound treatment, impaled objects. Do not remove an impaled object. Secure the object in place with a bulky dressing. Control the bleeding as best you can and treat for shock. Okay, like I said, this is part of the EMS 10 commandments. Don't remove impaled objects unless it is messing with your ability to manage an airway. And then we're treating for shock.
What if they're like trying to pull it out? Just be like, hey, like don't.
For sure. Say, hey, like leave that in there. Like, you know, try to talk them out of it. I mean, if you listen, I segue here. When I did my ride-alongs in Elko as an EMT at that hospital, I watched the old lady pull a catheter out, and I could not stop her, and it was traumatizing. Yeah.
Ooh.
Dude, she just straight up looked me right in the eye and went whack, dude, pulled that thing out, and then just started gushing. I was like, I don't want to be here.
You're on timeout.
I literally was like, help, somebody help. And the nurse, her super cool, her name's Sarah Pearson, was like, you are the help. I'm like, damn it. This ain't good. Mm-hmm. I was like, help. Literally. Yeah. Okay, impaled object. If you find perforation and can see both sides of the object, try to remove it. And this is in the cheek. Right, so that means if it's through, and you can see both sides, then you can take it out. Okay. If the impaled object starts to cause a problem for you in relation to your airway, that's the one time you can take this out. Okay. The one time you can take this out is if like I cannot manage this airway, they don't have a patent airway, I need to do something new, like that's okay. That's when you can take it out. Be ready to immediately start suctioning and managing those airways because you're gonna have some bleeding.
What if it's like through the neck? It's like
Like do the other side.
Leave it.
Leave it.
Yeah, I mean, look, here's the deal, right? So you have a knife through the jugular, right? Okay, this is a really bad situation, but I mean, if they are breathing on their own and it's not impeding their ability to maintain an airway, you're going to leave it. Sure, if it's transected and they can't breathe at all, I mean, you kind of don't have a choice. But at the same time, if you think about what you have there, if they've transected their trachea here, even if you take it out and try breathing for them, it's not going to work. That trachea is gone, right? Now, I'm not telling you not to do it. Now, if it's just impaled in the jugular and it's hitting the vascular systems, but it hasn't affected your trachea. I mean, if you take it out, they're probably going to hemorrhage faster. Okay. So tough situation. And then I'm surprised that nobody's asked the one that I get every single EMT classes. Well, what if they're impaled on a fence post and we can't get the fence post out to take with us and we can't do it? So then can we take them off? Like, yeah, obviously if you have zero other option and like they're impaled and you're not getting them out of there unless you take them out of the thing, like, okay, you should be calling a doctor before you do anything like that.
I think transport surgeons sometimes to sites
Yeah.
like that.
So the University of Utah has a field amputation and surgical team. They fly out to big helicopters with a couple, like one of them has like paramedics and nurses, and then one of them has like a doctor and all the surgical equipment, and they'll do like in-field amputations, and there's specific criteria. Actually, the guy that teaches that stuff comes out to Battle Mountain about once every 2 years and teaches our difficult airway class. His name's Corey Cox. He's a really good dude. Yeah, big fan. No. No, it's very rare. It's very, 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 very rare that you're going to get like a field amputation like that. And there's certain criteria to even launch them. Okay, impaled object in the eye. Who is here has watched Code 3? Nobody has watched Code 3?
That's the one with Rainn Wilson. Right?
Yeah.
Chad
Obviously,
Beckett.
you guys have.
Chad
No,
Beckett should.
dude, listen. Go home. This is your homework on top of the other homework, and watch Code 3. And congratulations, that's your intro to EMS.
It is.
It's like the closest EMS related movie that we could do. It's super legit. But there's a scene in there when he's talking about the eyes, okay? So I'm going to sit here today and tell you that you're going to cover, you're going to stabilize, like if I have an impaled object in one eye, right, I'm going to stabilize that eye and cover it, okay? If I have a cup, I'm going to put the cup over to stabilize that. I'm going to wrap it, but I'm also going to do the other eye. Who can tell me why I'm going to do the other eye? Yeah, 100%, right? My eyes, unless you're a little cross-eyed, which I'm not judging you if you're cross-eyed. If you're cross-eyed, that's fine. It's kind of a superpower to look this way and this way. It's really cool, actually. But your eyes don't move in singular motion, right? They move in tandem, okay? So if you've covered one eye, but now this eye is going crazy, that other eye is going crazy and you're causing more damage, right? So we are going to stabilize the object in one eye. If you have a cup to put over it, great, do that. And then you're going to cover the other eye as well and be reassuring, right? Think about what it would be like to have objects stuck in your eye and then like not be able to see anything, right? So take that sense away from yourself and you're going to panic a little bit. So think about what your patient would want. And that would be open and often communication, right? Okay. Avulsions.
Would it be to sing like Blinded by the Light?
Probably not great, but I did have a paramedic that used to sing Soft Kitty to our psychs as he was putting them to sleep. How did that song go? Soft kitty, kitty, little ball of fur. That's crazy. Super purr. Yeah. Mildly unprofessional. I'd recommend not doing it. Also, please don't think they wouldn't know where you're. Well, you got me there. I guess we should just fucking do it. I don't know. Yeah.
My EMT that is taking care of me is right over here.
It's right over here, telling me I'm going to be blind. By the way, don't tell them they're going to be blind. Tell them you don't know and that they need to go see an eye doctor. Okay. Avulsions. Clean the wound of gross contamination. Obviously, we're doing that after we've controlled all bleeding, treated our ABCs, and treated for shock. Okay. Fold skin back to normal position if possible. We're going to apply a bulky pressure dressing. And then we're going to preserve any of Vol's parts for possible skin grafting at the hospital. Okay. So you guys tell me, Cheek Man, should we take out leave?
Leave it. He's fine.
You can see both ends of it.
You said that you can see both ends.
Right.
so you
Yeah, I
can
pull it out.
Yeah. So you can see both ends.
But it's not obstructing there.
That part.
If it's not bleeding hella bad, I just leave it.
And look, there's like no blood in his mouth.
Then
You
you
get
have
more
to
blood
fix that.
from like pulling out a tooth than that.
Ooh, I like that we have a split room. I'm actually not mad at either answer, right? This is clearly not obstructing his airway. Yeah, clearly not obstructing his airway. He's not bleeding that bad. So I think there's a solid argument for leaving it. by the book, or at least by what Hannah put in here, you could take it out if you felt so inclined to. But with that not obstructing his airway, I would probably be more inclined to leave it and let somebody like that has some surgical capabilities do that. Mike, do you have a different take?
Personally, I would.
Yeah.
Like it's like, think about what you guys are doing and what you're able to do, right? It's kind of like we've talked about before a little bit, like the risk versus the reward, right? So dude has a pencil, great. Can I take it out? Sure. But just because I can doesn't necessarily mean that I should, right? So I could take it out, and what if I take that thing out and now all of a sudden the little blood vessel in there that pencil's obstructing and keeping it from bleeding is now unobstructed. And then I just took this dude who's relatively stable and given him right a potential airway compromise or bleeding, right?
Yep.
Like these types of things, as long as you don't have any concern for it, like in my opinion, like it's a much safer move to just say, here, lean forward, like here's some suction if you need it. And if we get to the point of needing to do something, sure, okay.
Yeah.
So for the sake of leaving it, could we put gauze around it on the inside of his mouth to kind of soak up whatever possibly is there? That way you're not really having the suction, or
Yeah,
should you have to worry about the choking aspect?
I wouldn't even touch it. I mean, like, unless it's like bleeding, sure. But like, if it's just a little bit of bleeding here and there, like, I wouldn't put anything in there. Same as
Tell him
like,
how much
hey,
you want it.
you ever been to the dentist before? Like, yep, here you go, bud. Sit
Yeah.
forward. If you need to, put your mouth around the suction and get rid of that crap.
Yeah, and that's a good point, right? Just because we can doesn't always mean we should. And I think sometimes going overboard is what gets us in trouble. All right, good talk. Now, how many of us are going to take out the spoon out of that guy's eye? Nobody?
Cup it.
That's crazy. So what are we going to do for that then? If we're not going to take it out, 100%. You're going to sing what to him?
So,
Yeah.
here's the other side of all the songs you should not play back.
Yeah. No, I mean, so the thought with the cup over the object is to keep it from bouncing around and hitting things, right? Like that's the thought with putting a cup over the impaled object. Now, is that always plausible and possible? No. Obviously, look at this. Like you're not going to put the cup sideways. I mean, I guess you could if you really wanted to, but the whole point is to stabilize it to the point where it's not causing further damage, right? And just think about how sensitive your eye is. What happens when you get a little bit of dust in your eye, right? Like that shit hurts, you know, you're like, how? So think about this and how much damage that's doing every time it's moving. So the thought is that you're trying to stabilize it as best as possible. Now, EMS is gray. We live in a gray world here. Things aren't always perfect for us.
It looks like it could be like an orbital bone too, because his nose is swollen, right?
Yeah, he's definitely got some.
Close to his brain, like in there. Because it's like swollen. It's a nostril on this side's huge, and the other one's smaller. So I think the initial bruise.
Think about this though, right? Like back to what Mikey said, like think of anatomy, right? Like is my brain down here? No, right? Like that thing is up here, right? Like if that thing is like angled up, okay, sure.
Pretty sure that somebody broke the end off of that because he looks like he's in a orange jumpsuit.
That's what I was saying.
That is awesome.
No need to stereotype.
But also, it looks like he was in a prior fight, because you can see abrasions on his forehead, like somebody smashed his face against something.
I don't even know if this is a real picture. If it is, this is gnarly, dude.
Sure. It's probably a real picture that they didn't get consent for because he's within the picture.
Oh, true. Yeah, but you're right? You have bruising around. He took substantial damage.
And then with the bleeding, there could be bleeding on the inside, bringing it back to the throat. Would at that point be just suction, right?
Yeah, just suction or
If it's further than.
you can just say, hey, buddy, sit up and spit out for me. You know, spit into the suction hose or spit into this.
Yeah, but with bruising that bad, you could have a possible concussion, and it's not like you're gonna check his pupils at that point.
Yeah, I mean, as long as he can follow commands to spit out for you, there's nothing else you're going to really do for him.
There's
But
nothing
yeah,
left now.
this
What do
dude's,
you do if you see this and you're like, oh my god, I'm gonna puke?
if you are personally going to puke,
Yeah, it's like, 'cause I feel like if I saw this.
yeah, no.
Look the other way, it's happened.
Yeah, then you just,
What do you do with that?
your partner, I'm going to grab some equipment outside. You go outside, you puke, you recompose yourself and come back in.
Okay.
And we all have those moments, to be honest with you, right? We do.
Have you puked?
Have I puked? Yeah. Yeah.
Just when he walked out.
Absolutely have puked.
That girl was giving birth. You haven't? You didn't
No.
say no.
I mean, I got close once, but
What
It's
happened?
not this stuff though. It's not like the gore. It's the smells.
Yeah.
Right. I've been in some houses where I'm like, no, I'm gonna be outside and or like you've never had that raging yeast infection where you're like, dude, Panera Bread could make a factory out here, dude. You know what I mean?
Yeah.
Those are bad too.
Yeah.
All right, back on topic. I'm so sorry, guys. Yeah, man, like it'll start chewing away at your skin, causing a lot of pain. You can get septic. Yeah, a substantial yeast infection. Yeah.
It can move to like your tongue and stuff.
Oh,
True. Okay. Open wound treatments, amputations. We're going to control bleeding. We're going to wrap the amputated part in sterile dressing and secure it. If we can, that doesn't mean we're not going to spend 2 years on scene looking for an amputated part. If it's readily available and we have treated our ABCs, done our March algorithm, we've stopped our bleed, our airway's secure, we're breathing okay, we're treating for shock, and we're ready to transport, and it's not delaying care, sure, like we can now take the amputated part with us. If we have multiple cops laying around, right, be like, hey, go find me this amputated part so I can bring it to the surgeon. We're not going to put it in water. We're not going to put it in milk. We're not going to put it directly on ice. We're going to keep it cool. We are going to put it in like around ice packs and keep it cool, but it's not going to be directly on it. The skin tissue is not going to be on ice. Okay. So you're going to wrap it with dry sterile dressing and keep it cool. Yeah, you can do a sandwich baggie. Mike, what's the craziest amputated part you've ever seen? Trains? Oh, like a dude got hit on the train. There's parts everywhere. But like, have you ever had a specific body part that
just
you would
like
say?
one part.
Yep. Never.
Plates. I mean, like trauma, like traumatic plate or something like that.
Yeah.
You?
Yeah, I've never seen like a super clean amputation, to be honest with you. I've had people where I know they're going to be amputated because like their arm is just hanging off by a little bit of skin tissue. But I've never had a very clean, like, yeah, the arm is over there amputation, to be honest with you. Yeah. Okay. Genital injuries, control bleeding. This is what I was getting at when I was asking you. Have you ever had a genital amputation?
Have you ever seen her bite his
I
dick
have not personally, no, but like we've had a few of them.
Yeah. Okay. So genital amputations or injuries, really no different, right? You're going to control bleeding and treat for shock, preserve any avulsions or amputated parts. I mean, you can inquire about sexual abuse, I guess. At this point, I'm just like, I'm getting you to the hospital. Okay. Burns. Burns is something you guys actually should put a decent amount of focus into. All of this, right? But burns is something that gets tested quite a bit. There's math involved in it and there's formulas. So what does that mean for you? That means these are either going to be easy gimme questions for you, or they're going to be up in the air whether you get them wrong or not, right? This is like knowing your GCS scale. Those are gimme questions. It's like knowing your sheet. Those are gimme questions. Okay. All right. Burns can affect more than just the skin. They can affect muscle, bones, nerves, and blood vessels. All of which you have in vital areas like your airway. We're going to classify burns by agent and source, depth, and severity. This is where you also have to know your anatomy and physiology. Okay. Okay. Thermal burns. When it's a thermal burn, I want you to think heat. Chemical is going to be, I mean, I think we all know what a chemical burn, especially you guys that work out at the mine and, have your SDS sheets and have, does anyone here work in like the lab setting or use things like lime and sulfuric acid and things like that? Yeah. Okay.
I put lime in the back of the hall.
Yeah. Yeah. Lime's one of those interesting ones, right? Yeah. So there's a reason that you're not supposed to, at least per MSHA reg, if I'm not wrong, if the wind is blowing a certain amount, right, you're not supposed to dump lime. So when I was out at Cortez, for sure, if the wind was blowing past a certain amount, you were not allowed to dump lime. Sick. I like it, dude. I'm personally, look.
I don't know when it's not windy up there.
Okay.
They have the most, Miracle has the most exceptional cab seals ever.
Okay.
So, I mean, I know I'm being facetious, but even.
So, anyways, chemicals. What is going to be the chemical? If you guys had to take a guess as to what is going to be the worst type of burn, if it's going to be an acid or a base?
Base.
Good. What made you guys say that?
That's not class.
Bases are bad.
Bases are bad. Okay, acids are bad too, but bases are really, really bad. Okay, electrical burns, light burns, and then radiological. Okay, and most of these are self-explanatory. What's the number one? If you had to take a guess, which one of these burns are you going to see 99.99% of the time? Thermal. Yeah, it's going to be thermal. Or if someone wanted to sit here and say, well, technically a sunburn is a burn, then I would let you make that argument.
No, because that's like a nuclear source, so that's like I guess. Usually, not always.
I don't know if I would classify a sunburn as a thermal or a light burn. What would you classify a sunburn as? Thermal?
Right.
Yeah.
Then it would be light because it's right. You're right. So it would be light.
So everyone here has had at least a first degree burn, right? Except for me, obviously.
Yeah, look at Shy Shy's scar. It's dope.
What is that?
A burn. That's a 3rd-degree burn.
How'd you burn yourself?
I was 6 months old. My mom put me on her bed and I rolled off my garbage between the wall upside down on the baseboard heater. And she thought I didn't want to take a nap, so she ignored my swings for an hour.
Damn, and I straight up just asked you, what did you do to burn yourself? That's crazy. Yeah, you should have probably made better choices at that age, but you know, I digress. That's fucked up, dude. I'm really sorry for your childhood trauma. That did not look fun. Straight up. Straight up. I don't know what to do here now. I know. Oh my God. Don't tell me that, bro. That makes me want to cry, and I am not a crier.
So sunburn.
Lose my mind, dude. As a sunburn is classified as a radiation burn?
Right.
That's crazy.
I know burns.
God, yeah. Okay. Superficial burns. Is a 1st-degree burn. Involves only the epidermis, right? This is where you need to know your burns. You need to know your layers. Reddening of the skin, possible swelling, right? That's going to be your sunburns. We've all had a 1st-degree burn or a superficial burn. Partial thickness is when we get into our 2nd degrees. Epidermis through the dermis. Deep, intense pain, reddening, blistering, mottling. What is mottling?
Modeling is the pink and white Dalmatian looking shit you get in your skin.
Yeah, so you have some circulatory compromises starting to happen, some tissue death, right? And then full sickness, 3rd degree. All layers of the skin are damaged. Some areas may have been charred black or brown. Others may be dry or white, may have severe pain or no pain depending on how deep it is and what nerves have been affected. This will probably require skin grafting. Okay. I mean, I guess it would depend how deep it goes and how bad it is, right? Oh, good. It is. She did put it in here. This is what I was looking for earlier. Okay. I think this is a really good illustration, right, of what burns and how deep it goes. Okay. So your 1st degree, just your epidermis, just that top layer. Okay. You're going to have some nerve endings in there. Nothing too crazy. I mean, even if we've all had a really bad, sunburn, like you're probably not going to have a ton of ramifications from a really bad sunburn from like top to bottom, right? It's manageable. When you get into your 2nd degrees, right, and then you start affecting the dermis, you'll probably get some more temperature regulation issues, some more fluid movement issues. Obviously, this is where you're going to get your blistering and your big amount of pain. And then 3rd degree is like, that third degrees. 2nd degrees can put you in a lot of trouble too. Don't get me wrong, especially if you have a large portion of your body. But 3rd degrees are really the ones that we need to be really cognizant of. So if anybody can tell me what they think the last hand on a 3rd degree, what do you guys think that came from? Why? Okay. Yeah, that's probably going to be an electrical burn. Okay. As we go through and talking about burns, I think it's important to note that this is what I would constitute as a distracting injury. The burn itself is not going to kill them the fastest, right? If we let them get hypothermic, that can kill them. If we don't recognize a compromised airway, hypoxia, things like that, that can kill them. So yes, you might roll up on a nasty burn and get tunnel visioned onto it. You have to realize that you have to go through your ABCs first before you can start really treating these burns. Okay.
Depending on the burn, it isn't necessarily a life threat.
Yeah, I would say even a 3rd degree burn encompassing the most of your anterior chest is not immediately going to be life threatening from the burn itself, right? Now, if they sucked in superheated gas and now they have swelling of their airway, if their lungs have been burnt, things like that, then that is going to kill them faster. Or now that they've lost a large majority of their integumentary system and they cannot regulate temperature and get hypothermic and start this cascade, right? That is also something that can be life-threatening. Okay.
It depends on the source of the burn, because like electrical, cardio problem.
Absolutely right. Yeah. It's all in context as to the situation.
But the burn itself is not the life threat.
Correct. Also,
what is think about this too, right? Like, what is the overwhelming majority of burns also come with?
Airway issues.
I mean, eventually, right? But like
Swelling.
Trauma, right? Like a lot of them are associated with some other form of trauma, right? So like, same thing. I don't want to say don't worry about the burn, but for the most part, right? Like, kind of to Mikey's point, like the burn itself is not necessarily the problem. Like, it's the underlying associated trauma, right? They were burned because they wrecked their car and got trapped in it as it caught on fire, right? Or airway problems, right? Like electrical is kind of a different thing, but majority of your thermal burns, like the burn itself, like that thing is sterile for 24 hours, right? Like they don't start fluid shifting for like a little while. Like it's not immediate, right? It's underlying trauma, airway problems, hypothermia, right? Stuff like that.
Yeah. Also, if you get a test question like this that says, you have a burn patient that also has a femur fracture, are they going to a burn center or are they going to a trauma center? Trauma center, because trauma centers can treat burns. Burn centers generally don't treat traumas. Okay. Isolated burns, burn center. You have a mix of both, trauma center.
The reason they go to hypothermia is because they lost layer of skin that helps protect your heat, right?
Yep, absolutely. Yeah, right. That's the main function of your skin, is to regulate. Okay. Determining, classifying by severity, face, hands, and feet, and circumferential burns are most dangerous. Can anyone tell me why? Okay, so I want you guys to think about, I mean, obviously, anytime you have an airway burn, you have to have a high index that you're going to lose that airway. But at least we'll touch on circumferential burns as to them being dangerous. Why would we think that a full circumference burn would be dangerous? Yeah, so you can start to swell, and what happens to burnt skin? Is it elastic? No, right? So now you can start developing what's called compartment syndrome. Were we talking about fasciotomies the other day? Yeah, right. So that's when you have the cutting that happens to alleviate that. Same thing, right? If you get a large area of your chest wall burned, now all of a sudden your ability to expand goes away, right? It doesn't even have to be all the way around, but if you have a large portion of chest wall, that thing we do, which is breathing, gets compromised, we can die from that.
So as EMTs, you should, I mean, obviously we should not induce any more injuries to the patient. However, how rapidly do we expect compartment syndrome to take effect?
I would say situation dependent, but I would say a couple hours at least.
Okay.
Is that pretty accurate?
Yeah, I mean,
Yeah, a
like,
couple
that's
hours.
ridiculous.
Yeah.
So let's say we're bumfuck nowhere. I know this is a big metropolis area,
Yeah.
but would it be within our scope of practice to at least relieve a little bit? Not at all. We'd get our license revoked. and everything,
Absolutely.
even if the
I don't-
patient is at threat of dying.
I don't even think a paramedic could get away with that. I mean, do you know anybody that's got fasciotomy in their scope of practice?
Like not a big one, but
So we
something.
had a fasciotomy, C50 for chest. We didn't have that in the state of Nevada. Like organization where we had it, we were able to do it in other states, but
Not in Nevada. Yeah, I mean, that's one of those, like, you know, you got to be comfortable two things. Like, one, you got to be comfortable with the outcome. And two, you got to be able to look yourself in the mirror at the end of the day, right? If I have a little kid that's going to die if I don't do it, I'm perfectly comfortable walking away from EMS and then going to Golden Gate selling coffees and zins to everybody the rest of my life, being just fine with what I did, right? So, the golf course? Nah, dog. I like the Golden Gates right across from my house. It's nice. It's off the beaten path. They got good coffee. They got good zinni. Like, it's not super booming. Like, it's cool.
So at that
Chicken.
point in time, would you still call medical direction and hopefully they possibly say, you know, Bill, this is best, then
Yeah. Yeah. A good rule to carry with you the rest of your life is don't ever be the smartest person in the room. Right? Like, if you can pin that decision off on somebody with more letters after their name, absolutely do that every time. I don't know.
they can.
They
right?
can,
Like, this is where
yeah.
it sparks the discussion of like there was a case over 5 years ago now, but it was back in New York. It was a traumatic MVA. Mom was pregnant. Right? They get there. Mom codes.
That's right.
They call into the hospital, talk with the ER doc, the OB, the surgeon, like, hey, like, this kid is moving, so we want to try and cut him out. And they walked him through it, and they did. They saved that kid. The husband then turned around and sued them and won. And every one of those docs lost their licenses. The two medics did. So same, it's like, to Mikey's point, right? Like, that's an individual decision by all stretch, right?
Yeah.
Like, if you're and you're willing to risk your livelihood for it, that's on you. But don't think that just because the doctor told you to do it means I'm good to go now.
No.
No.
you're still good.
Dude, you would be amazed at the amount of people that end up suing for the things that it's tough. But yeah, like I said, you can bank on two things. One, you're going to lose your license, but really what matters most is like, can you look yourself in the mirror at the end of the day? And I think that's my litmus test for the most of the things I do. Okay. So face, hands, and feet. Why are these potentially more dangerous, or we need to put more emphasis and focus into them? Yeah. Yep. So just so you guys know, genitals, hands, feet, all fall in the CDC trauma criteria. So I believe it's like if you have a 2nd degree or higher, like the recommendation is you go to a burn center, even if it's a small area, right? Like you burn your hand, you're probably not going to, like, you're not probably going to need a bunch of skin grafting or like you're not going to go hypothermic from it by any means, but it is because of the movement, and it's a specialty to get somebody to work on hands. The risk of infection is super high. Yeah, so these actually, most of these fall into the CDC trauma center criteria. And then I would say face for me is probably going to be because of the superheated gases and the potential to lose an airway. Okay. So rule of 9s, this is something we're going to learn, and you should have this down. Like I said, this is going to be a gimme question for you, or a couple gimme questions for you. The rule of palm is I don't remember. Okay, so it's the patient's own hand. So you take the patient's hand, and the palm of their hand is 1%. Okay, so if you took roughly the size of their hand and you moved it across the burnt areas, that would give you a rough percentage of how much of the area is burned.
Just 1% every time you put it down.
Yes, and it's their hands, right? So you get a 20-year-old like young female that's not very big. Her hand is going to be not Andy's, right? So if Andy's like, yeah, she's got 3% of her body's burned, it's probably like 45, right? Okay. Rule of nines is probably the one that they're going to throw at you on your test, though, just so you know. Like, you can do the rule of palms in the field if you want. 90% of the time when you see this on a test, it's going to be the rule of nines. And there's one for pediatrics and there's one for adults. So you need to know this. Head in its entirety is 9%. Anterior chest is 9. Posterior thorax is 9. Abdomen is 9. The back is 9. Arms are 4.5.
The whole arm itself is 9, front and back.
Yeah, I believe so.
Yeah.
Yep. 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 You can say genitals. It's okay. It's okay to say genitals. All right. And then each leg is 9%. Okay. This is going to be the pediatric one. 18 front, 18 back. 9, 14, 14, 1, and then 18. So what's the big difference between that one and this one? The head, right? So the head is double what it is on an adult for a reason, because kids got big ass heads. My 1-year-old walks around here bobbling around with her head, dude, and that thing is just jacked up. She's got buck teeth. Cutest thing in the world. Really? Yeah, dude, kids got fat domes. Okay. Treating for burns. I'm going to emphasize this again. Don't get caught up in the burn. Treat your ABCs and treat for shock first, okay? Once we've got through that, then we can start on the rest of it. ABCs, airway injuries can present with a hoarse voice, charring around the mouth, nose, or face. You can also, in later stages, have what's called stridor. Have you guys covered stridor? Right, so hot potato voice, hoarse voice, then can turn into stridor. Any one of those high index that you have an airway compromise. Soot in the mouth or the nose also should give you a really high index that you're going to have an airway compromise, okay? We're going to stop the burning process when it's safe to do so. So if we have a flame, wet it down, smother it, remove any clothes or jewelry. And then semi-solid stuff, cool with water. You don't want to be debriding this yourself, okay? Like if they have like plastic melted to them, you're not going to take that off. Like you're just going to make them as comfortable as possible and get them out of there. Wrap with dry, sterile dressing. Years ago, this was taught that you did wet. That just made the debriding process worse. So you're just doing dry, sterile dressing. Debriding. So if you ever want nightmares, and I actually have a friend who spent months up at the University of Utah's burn center after he was burned. And like when he tells me about the screams he heard from the debriding process, it actually makes me really, really sad. And he said that, there was like a little girl that was rooming right next to him. And when they would debride her, that she got all the drugs in the world and she would scream and scream and scream. And it just, burns her. I don't know, man. That's exactly what it is. Yeah. Until it comes back as rejuvenated tissue. Blisters, the scabs, until you have pink tissue coming back and good blood flow. Do you remember when did they have to do that to you? If you don't mind me asking.
I don't remember.
Oh, okay. Yeah. Yeah, and so those burns are super common in kids, right? Why? Because they grab the stove. Yeah. Oh gosh. I've let my kids fall off the table a couple times. So yeah. Yeah, consider, I would say anytime you have a severe burn, consider calling ALS, right? Like you can do a lot for them. Even we can't do that much, but we can treat their pain. We can start an appropriate amount of IV fluids. So that's probably, like, if you have the ability to call ALS, you should do that. And then cover both eyes to minimize movement.
Like, don't let them see that you're debriding their burn.
We're not debriding anything. I
Oh,
would
I
never.
know.
Yeah, but yeah. I'm assuming she means more than anything. If you have like a burns to the eyes, that you're gonna do them both. Chemical burns, we're gonna wash away chemicals with continuous flowing water for at least 20 minutes. Apply sterile dressing. Treat for shock. Transport. Obviously, this is going to be a little bit chemical specific, because what if that chemical is a powder? Do we start with water? No, right? I'm gonna dust it off first. Fun fact, who can tell me what activates the burning process for Lyme? What neutralizes the burning process? Water, right?
So explain that.
I can't. I'm not a chemist. Mike, explain it.
You can't, because they sit there and they say rinse with water, but it activates.
So you're supposed to brush it away and then you wash away with copious amounts of water.
Yeah.
But it activates with water though.
Right, so you're gonna activate it, but then you're also gonna wash it away.
Because dilution is the solution to pollution.
There's like a backdrop company, so we used to go suck out lime silos, Barbasol shaving, instantly makes everything better.
Really?
Yeah.
Interesting.
We had like cases of Barbasol.
Yeah. Just think about this, right? You can have a lot of things that will cause a chemical burn, a lot of household products. So the battery dust that comes off the batteries, is that what kind of chemical is that? It is a caustic chemical. It is caustic. Is it sulfuric acid? I was actually legitimately asking. I actually don't know shit about cars or working on
I
them.
think some batteries are, there's a guy I worked at had a battery blow up his face.
Potassium carbonate,
Potassium carbonate.
according to Google.
Is that a base or an acid? It's a base, right? That's why that's one of the worst. Like, you really need to be cognizant of those. Yeah. Anyways, most of your chemicals in your house are going to be, like, your cleaning chemicals are going to be fairly acidic, right? That's how they cut through and clean. Chemical burns, mixed or strong acids or unidentified substances. Our go-to is going to be washed with flowing water, dry lime. We're going to start by gently brushing it off, and then we can do copious, Barbasol shaving. Copious amounts of water if it comes up on your test. Carbolic acid, do not mix with water. Use alcohol for the initial wash, followed by water. Sulfuric acid, wash with water, and then hydrofluoric acid, wash with water. Right? Water is going to be your common one. For you guys that work out at the mine, like, feel free to use your SDS sheets. Radiation burns. I don't know how you're going to detect them. I think they're called, what is those things called? Geiger counters? Right. I'm sure Marigold doesn't have a Geiger counter. We don't have a Geiger counter. I don't know. The county might somewhere. I don't know where it is. I would think I would know. But yeah, it would actually be pretty hard to detect radiation stuff.
Some people do wear radiation badges on site.
Oh, is that like in your smelter and stuff like that?
I'm not sure exactly where, but.
It's in process.
Is it?
Process and passing them.
Oh, really interesting. That's actually would probably be a pretty good resource then.
But also with radiation burns, there are some like UV lights and stuff. I know a couple people who, like a kid who got really excited looking at the fluorescent rocks at a mineral show, and he ended up getting radiation burns to his eyes.
Ooh.
Because, the UV.
That's crazy.
Or I guess that would be a light burn. I'm sorry.
That's still super crazy.
But yeah, so just be careful with UV. Like, it might seem fun for a wee bit, but do not expose yourself to it. It does a lot more damage than you think on
That's
like a cellular
crazy.
level.
Contact with a source or patient contamination with radiological materials can pose a risk to the EMT's well-being, right? Seen as not safe, don't go in there. Like, it is what it is. Our number one thing is getting ourselves and our partners home safely every night. And this goes with like hazmat as well. Or if you have chemical stuff in a hazmat, like guess what? If there's a bunch of what's that stuff you guys use to process on the line?
Cyanide?
Yeah. If there's a bunch of cyanide, like I'm not going in. I'm sorry if you die. Usually we won't treat people that are not deconned. Okay. Electrical injuries, electrical currents, burns where the energy entered and exited the body. If you think about the way electricity works, what path does it take? Least resistance, right? And a lot of times that will be you. Okay. Can result in paralysis, muscle tenderness and twitching, respiratory difficulties, can kill you, right? Like irregular heartbeats or respiratory arrest, like it can cause sudden cardiac arrest, right? What does your heart use to beat? It uses electricity, okay? It could cause blood pressure shifts. In really, really significant ones, it can cause fractures. Obviously, it can disrupt brain activities and cause seizures. There's a super cool video out there of like 4 dudes getting just zapped on a soccer field by lightning. And there's like a video of a dude getting hit twice by lightning and he just keeps getting up. So just because you get hit doesn't necessarily mean you're going to die. And by the way, if you do die from an electrical injury, from electrocution, we have a really good shot at getting you back. If we get there fast enough and shock you, you have a really good shot at coming back. Okay? Don't be distracted by the burn. ABC's first. We're going to treat life threats, treat for shock. Right? Cardiac life support is needed. Don't get caught up on the burn. The burn is not going to kill them. If you get caught up and you miss something big, that could kill them. Okay? We're going to treat for shock. If it's a bad burn, you want to absolutely consider C-spine precautions because you can have an associated trauma. Look for an entrance and an exit point. If you have water to cool the burn area, you can. I wouldn't, like if they have a lot of burns, I wouldn't dump a bunch of water on them, right? Because you don't want them to go hypothermic on you. We're going to dress and bandage and transport them to the appropriate place. Okay, that is all we have. Is there any questions at this time?
So with electrical, it said that you obviously need to take like C-spine precautions.
Yeah.
Say an electrical causes somebody to go to cardiac arrest. If they have like a spinal step off, I'm not doing chest compressions, right?
Sorry, dude. I'm sorry. I was switching over. Say that again. My apologies.
Electrical trauma causing them to go into cardiac arrest. If they were blown back from something and now they have a spinal injury, am I doing chest compressions to try and get that heart to come back?
If they have a spinal cord injury, 100%.
Okay, you still are.
Yeah. Are you saying like, am I doing chest compressions or am I treating the spinal? Or
am I doing chest compressions to try and
like even
Because
though
of
their
the
spine is off, would you still do chest compressions?
Yeah, 100%. Yeah, 100%, right? Because who's to say that you can't get them back, send them off to a surgeon and they can fix it?
Right.
Yeah, 100%. Yeah, you're definitely going to, and you have a good shot, right? If they die from an electrical burn or an electricity issue, and you shock them fast enough, because it's not going to be the CPR, it's going to be the shock. You have a decent shot at getting them back, getting them off to a surgeon. And then, a lot of this stuff is not like, okay, they might come back if they do have a bad injury, they might come back a quad or a paraplegic. At least we gave them the best shot we could, right? And sometimes that's the game we play, honestly. Sometimes we send people out and we're like, I would not want that to be me. I don't want to die before coming back like that. But that's not our calls to make, right? Our job is to give people the best shot. Let me see. I'm going to pull up Becca's real quick because Becca had a really, really, really good
If you were gonna be a vegetable, what vegetable would you be?
broccoli.
Are you shy?
Oh,
I'm not gonna be a vegetable, I'm gonna be dead.
you
I
wouldn't?
already told my parents that I'm ever
I would be broccoli.
accident,
On
that
Sundays,
they better
I
take
really
an
like
accident,
broccoli.
I will not let them.
Do nothing.
I do not give 2 shits. Then my
Uh,
got red, so I could see it.
So when it comes to amputations, are we putting tourniquets on all amputations? I'm going to say no. You should have it ready. But I believe your book says that you are not putting tourniquets on every single amputation, if I'm not mistaken. Yeah. And you need to have a really high index of suspicion for it, because when the vasculatures and the muscles start to lose their tone, you'll start to bleed, right? So have your tourniquets on. So I just wanted to show you guys some of these. Dang it. Lakin can't see this. Oh, bummer.
I thought I was looking for the kneecap. You donkey.
Dang it. Sorry, Lakin and Tina. I will show you these later. I don't know how to share it, I guess. Anyways, okay, see the cup there? Like that's what I was talking about with that. Okay.
What if you misjudge the life of the object? You put the fucking cup on there and you shove the fucking.
Use the styrofoam cup.
This is goes in there more. You're like,
What's
"Mm,
up?
sorry.
Styrofoam cup for the eyeball.
Well, because technically you're supposed to like keep it steady, aren't you? While you're placing the cup.
Okay.
Because how we had
Any
the gauze wrapped around it.
questions?
I have one.
Holding it like say it's a pencil, right?
I wouldn't put it like this. I'd like.
Well, yeah, but like it's solid.
But people that like hit the person in the chest, is that a real thing?
It is. It's an outdated practice. It's called a precordial thump. It really doesn't work.
I've done one.
And it worked? You did a precordial thump during VFib and it worked. It's retarded is what it is.
Yeah.
Did it work? There you go.
That's crazy.
I mean, he ended up dying. But
So
he
the-
could convert, like, now, does it, like, is it something that routinely works? No, right?
What is it?
You hit him in the chest.
Oh.
Yeah, you hit someone in VFib in the chest and you can convert them. Yeah, so Damar Hamlin, that's a textbook case of commotio cordis. Those guys, if you can get there and shock them in time, have a really good chance of surviving too. Right? Like, yeah.
So they should just have one on the field at all times to be able to shock these guys.
What's that?
So they should have.
Basement.
Yeah.
Oh,
Do we have any more questions? Anybody have any more questions? No, it's okay. Nothing. We all feel pretty good.
Yeah.
We all know our rule of nines in adults and pediatrics. Okay. So what is the rule of 9 for a child's head? 18. Okay. What about an adult?
9 for the whole head.
14 for what? The leg.
Right? Yeah, that's the difference between the adult and the kid, right? So adult, 18, and everything else is nines, right? What do you think about it? And then for the kid, the head is 18, the legs are 14, nothing else changes.
Okay. Good deal. Well, if that's it, then we will conclude the lecture portion and then we will dive into a little bit of skills like wound packing, tourniquet placements, things of that nature. No more questions? Okay. Lakin, Tina, do you ladies have any questions for Michael Hoover?
Why you got there?
It'll be for Emperor Harris.
Emperor Harris.
Dude, he's such a dick. He calls me Mondays he calls me Warden. Tuesday he calls me Emperor. Wednesday he calls me Dictator. Thursday he calls me. Dude, it's just crazy, bro.
I thought they were calling you Hoover. I didn't know you guys were both.
That's the beauty of it.
Yeah, that's.
Yeah.
I was like, wait, why are you calling him fucking Hoover? Like his last name's Harris. No, we're talking about Hoover.
Yeah.
That's why it's changed.
All right.
Or dictator
Works out so
or.
well, like when I do something wrong,
What do you mean, baby food?
Baby Hoover and Daddy Hoover,
Yeah,
Daddy Hoover.
they worked on our tree the other day.
All right, guys. Well, then I'll cut you loose and we'll start on some skills. Tina, I'm under the impression that you have access to do some skills today. Lakin, I will catch you up on skills in the upcoming week. Enjoy your time. Again, you have 2 chapters you're being tested on Tuesday. Thank you for putting up with me today. Have a good day. Perfect. Awesome. Thank you very much. Thank you, Kim, for doing skills with her and staying late. I appreciate you. Such a dope team
Well,
I
yes,
have.
no, it is, because I work Sunday.
Okay,
Yeah, here's this Sunday.
we'll break. Yeah, pee break. Let's take 20 minutes.
Yeah, back up recorded.
Bro, if he punches you in the chest, dude, you're toast.
Just give her the beans, dude. If you're gonna do it, I'm not real good. I know. You guys said next week's lyrics are worse.
Ray, you know Jipper?
Is that your middle name? Ray? Oh, that's right. Listen, I know a couple guys with Ray. It's a strong name, brother. It's a strong. You want to talk about conquering the world? That's a good. Dude. I would have look. You don't look like a. Listen, I'm gonna. I just broke them. Oh, am I what?
Are you done recording?
I'm guessing you're about to talk some shit.